let me introduce Lee E. MD, Associate Professor, and she is a licensed Chinese medicine doctor, over 20 years of experience in acupuncture, teaching and clinical practice. I am really very happy today to introduce her, because you see, in the morning session they actually came to Dhaka University, and as a part of their visit we from Faculty of Pharmacy invited them, and she is the expert on acupuncture, and she gave a lecture on the details of acupuncture towards the students and the pharmaceutical scientists, those who are present over here. Now I have the opportunity to having her in our faculty office, and as the Dean of the Faculty of Pharmacy, I have got profound interest in acupuncture, and I am very happy that after her lecture she actually demonstrated practically towards our students and did some experimentation on them on acupuncture, and the students are so happy, and we have made the live video of that. Now I would like to just thank you very much for coming over here, and would like to first of all hear from you, from your view, that you are a specialist on acupuncture. So how you find it in China, and what do you think that, because you have also been introduced with some of the Bangladeshi counterparts, some of the Bangladeshi acupuncture specialists. So I will first of all hear your experience from China, and then we will hear your experience that what could be done in Bangladesh. Okay.
Thank you, dear Dean. It's my great honor to be here and to have some the lecture to the faculty of and the students of the College of Pharmacy. And from my aspect, that the acupuncture has been long-term used in China even from the ancient times, and it's still have a very strong life in China now. And since it's very simple to practice, we can just use one tiny needles and some kind of moxibustion, and it's easy to practice with these methods under the guidance of the Chinese medicine theory, and it works very well. And in the topic lecture, we say that it was recommended by the WHO for many times to treat many conditions and symptoms and diseases for the human problems. And so nowadays, more and more people are realized its effectiveness. So it's widely used and in the whole world. So I've been to the Europe countries like the Malta and the Greece and also the United States, and they are very welcome to acupuncture, both the clinical practice and the training. And so I think that with more realization about the acupuncture effectiveness, and they will arouse more interest in the acupuncture training or practice all over the world. So I find the trending a little bit in Bangladesh, and I think that it's a very promising area for the Chinese medicine and be spread in Bangladesh and benefit the health of the Bangladesh people. Yeah.
Professor, you know, in Bangladesh, people are having a lot of back pain or frozen shoulder and some other indications also.
Yeah.
So, in particular, I am interested to know from you that what treatment you actually give for the frozen shoulder or back pain. So, would you please just specify the reasons, and also what is actually their feelings initially, how this pricking the needle underneath is actually alleviating the pain. So I would like to hear a little bit more on this topic.
Okay, my pleasure. So we know that acupuncture is very good for the pain management, for a lot of pain, including the neck pain, shoulder pain, sciatic, and also some pain related to cancer, and we will do a lot of practice already. And so I will take the shoulder pain for an example. We treat not only on the local because it's the affected area. And according to the TCM and the meridian system, we also know that this area can be is the running course of the certain meridians. So when we do the diagnose and we have a meridian diagnose, for example, if the pain occurred in front of the shoulder, anterior of the shoulder, then we can choose the corresponding meridian.
Okay.
We call it the Yang-Mi meridian. And if the position changed, it's local the middle size, and we change another meridian. So not limited on the local one, and we also choose the distal point according to the different meridians. Yeah.
Okay, so you tell that if the pain is over here, definitely in a distal place it's connected.
Exactly,
So,
exactly.
okay.
So we say that the treatment is individualized because the patients, even they share the same symptom, shoulder pain, but they have different location. Then we will change to corresponding the treatment to settle the corresponding meridians and the corresponding acupoints.
So after each session of acupuncture, do the patients need to take some rest, or they can straight away go for their works?
Yes, we advise the patient they can make a pause after maybe 10 or 15 sessions, and then for several days, maybe 1 week, and then they can continue to the next progress. And we say that the effect of the acupuncture is accumulative effect.
Okay.
So for the chronic condition, it works like this.
So what about like the disc prolapse or dislocation of disc, the lumbar, the problem where actually doctor suggests that surgical operation is a must. Do you think that acupuncture can actually cure that?
I think that for the structural problem, actually we do not do too much on it.
No.
Yeah, except for the surgery, right? But with the acupuncture treatment, we can adjust the tissues like the muscle, the ligaments.
The extraneous part in the body system.
And we can adjust the function of the surrounding tissue, and some may be caused by inflammation, and the acupuncture can control this. So with this.
So how far the needle is inserted? Is it just transdermal, means is just on the skin, or how much depth it is actually going? Because I have seen that you were very carefully pointing out the point. Because the specialist doctors know the point of that you will press it, no?
Yes. First of all, the safety is the first thing to take into consideration. And the different area we need a different depth. So it depends on the area. For the lumbar area, the tip of the needle will go deeper. But for the safe consideration, it also corresponds to the patient's feeling.
Okay.
If they find it's too strong, then we will not.
So you have different lengths of the
Sure,
needles and
sure.
different size also.
Yes.
And I was observing the video, in one video, that after pushing the needle, you were twisting it like this way. So what is the benefit of that one?
We call it manipulation.
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 Okay.
And they have the function, first of all, to strengthen the sensation of the needling. And also we will do the corresponding manipulation. We call it reducing or tonifying, cope with the condition of the patient's, if we say it's the excessive pattern, then we use the reducing method. And if it's the deficient condition, we will use the tonifying manipulation.
Okay.
So to make the balance of the body.
Okay. So last thing I need to know, for example, we understand that this is a very safe procedure because you are actually superficially and externally doing it. But if in any case there is some sensation of pain, etc., do you go for the allopathic treatment of medicine that gives some pain killer or pain remover, like paracetamol or other types of drugs, NSAID groups of drugs, as a secondary mode of treatment, especially if the patients suffer from for some reason they are feeling pain or not getting well soon. So you go for the secondary treatment also?
Yes, just like which we mentioned. Nowadays, acupuncture may be a supplementary treatment along. It's not the only treatment. It's go alongside with the
Exactly.
alongside with the Western medicine and to amplify the effects and reduce their side effects.
Yes, that's why you were talking about that. Actually, 2 or 3 types of treatment procedures sometimes can be amalgamated together. Yes. So, how is your so far? It is your first time visit in Bangladesh, I
Yes,
understand.
yes.
So, you have been around the Dhaka University and some few places. So, so far, how would you feel like?
Yeah, I think we've received a very warm welcome, and you are very hospitalized to have us, and we are encouraged by the collaboration in the future time, and we would really look forward to that.
Okay, so are you excited that we are going tomorrow to Beacon Pharmaceuticals Limited?
Yeah.
So we are looking forward that they will probably show their technologies and techniques, and we'll have a very nice time over there. So thank you, Professor, very much for coming to Bangladesh and especially planning to visit to Faculty of Pharmacy. I can assure you that I already have report and heard from my colleagues that the students are very happy, and especially when you are delivering your lectures, that was so lively that each and everyone present in that auditorium, they enjoyed it thoroughly. So thank you very much, and thank you again.
Yeah, my pleasure. Thank you.
Thank you.